All right, how's it going, Philip? My name is Tyler. I'm a student of physical therapy under the direction of Dr. Wright. I see on your intake form you do prefer to be called Philip, but is it okay if I call you Jimmy for this session?
That's fine, yeah.
All right, I see that Jimmy is your middle name.
Yep.
And then since your parents are not here and you're 17, is it okay if I just give them a quick call to see if I can get consent to treat you today?
Yeah, sure.
All right. Yes, this is Tyler Janowski, student of physical therapy. I'm here treating your son, Philip, today. I'm just wondering if it is all right that I get your consent to treat since he is a minor. I'm going to be placing my hands on his neck area, his head area, and his upper back. Is that all right with you? It is? All right, thank you. Okay, so can you tell me a little bit about what happened?
I basically was just, I had head-to-head contact with a different player while I was playing soccer. And then ever since then, well, they told me that I had a concussion, and then ever since then I've just had like a headache that's been pretty, bothersome over the course of the day. Like, it doesn't really seem to get much better, but it's just pretty constant. So it's probably like the biggest problem. But yeah, it was basically just knocking heads with somebody at a game.
And so with that, did you have any symptoms other than that headache that you mentioned?
Yeah, I was pretty dizzy. I guess you would call it like vertigo, or I guess just like the room is spinning type feeling. That kind of also just comes and goes. It really just depends on like what position I'm in. So like I could be bending down and then I start feeling dizzy, or I start getting a worse headache. So it seems kind of like a positional thing. So like if I'm just sitting here like at rest, like it's pretty fine, but like it gets worse if I'm moving around a ton, or if I have to like move my head really quickly in one direction. That also bothers it.
So we got some dizziness, kind of a headache with bending over, quick head turning, things like that?
Yeah.
Okay. Any other symptoms when you perform those movements? Just mainly that dizziness, headache?
Yeah, I believe so. That is it. I think.
Okay. So, and then when it happened, what would you say your pain level was at? When you went head to head, and I know you didn't have consciousness right after, but kind of, what you remember.
I just remember, the headache came about after that injury, and then it's like, it kind of is just always there. So like at best, I would give it like a 6 out of 10, and then at worst, it's at like an 8 out of 10. Like right now, it's pretty bad. It's at like an 8 right now. So, but as far as, I don't really remember a lot about the injury itself, but all these symptoms happened directly afterwards, and they said that it was pretty consistent with a concussion. So I'm not really sure what you're going to be able to do for me, but it's, yeah.
Well, I saw in your intake that there was an athletic trainer there, and that's and that you also went to the hospital, so that's good follow-up as well. I know that I'm seeing you about a week after it happened. Have you been doing anything? Did the people at the hospital tell you anything? Have you been taking any medications?
Yes, I have been taking just over-the-counter stuff.
Is it just the over-the-counter ibuprofen that you've been taking?
That's it.
Okay. And has that been helping at all?
No, not particularly. It maybe a little, but that's when I can get it down to like the 6 out of 10, but it doesn't really go away.
Okay. I'll look into some things that might be able to help with that, and we'll do some things today that might be able to help with that as well. And so, I think with that, what are you kind of looking to get out of coming into physical therapy?
Getting rid of my headache would be cool. Again, I don't really know what you're going to be able to do for my headache, but maybe you'll be able to help me with that. And then I kind of wish I wasn't dizzy, and I just want to go and return back to school and running and soccer and my normal life, because right now it's not normal. So.
Okay. And so that's getting back to that return to sports kind of really important to you, getting back to physical activity.
Yeah.
Okay. That's something that we can work on as well. So getting into it now, I'm just going to do a couple tests. So the first thing I want you to do is bend forward, place your elbow on your knee, and just sit there for about 10 seconds. Will you let me know if there's any changes of symptoms, anything going on, or you feel fine?
Feels alright to me.
Okay, that's 10 seconds. This time you try the other side. Still doing all right? And a big thing is you can relax. During any type of these kind of tests and measures that I'm going to do, if anything, flares up your symptoms or it's something familiar with your symptoms, please let me know. It's very important.
Yep.
So the next thing I'm going to have you do is sit up straight. And I'm going to have you look over to your right. Okay. Look over to your left. Look straight up. And then look down. Perfect. Okay. Next thing I am going to do is have you look at the tip of this orange triangle, and I'm going to have you follow it with your eyes. Okay. I'm going to hold my fingers out. We're going to look at the right one, and then when I say left, you're going to hold your head still though. Look at the right one, you're going to look at the right. When I say left, you're going to look at the left. Okay? So right, left, right, left, right, left, right. Next thing I'm going to have you do is hold your hands out, just like that. I want you to look right in that crease between your two thumbs, okay? Alright. No problems with any of those? Okay. So the next thing I'm going to have you do is actually put your feet up on the table. I'm going to do a long sitting position if you know what that is. That's what it is. I can't do that because my hamstrings are short. Okay, so the next thing I'm going to do is called a Dix-Hall pike. It's just another test. So at any point, let me know any reproduction of symptoms, anything like that, okay? So what I'm going to have you do, I'm going to hold your head, okay? And what I'm going to do is just drop you back slowly. I've got you, don't worry. And you're just going to tell me we're going to hang out there, okay? Ready? You doing okay?
Yeah. Doing fine.
Okay.
Maybe a little dizzy, but nothing crazy.
A little bit dizzy?
Tiny.
Just a tiny bit?
Uh-huh.
Alright, and then I'm going to help you back up. We're going to do the other way now. Okay. How you feeling?
Pretty dizzy here.
Pretty dizzy here? Yeah, okay. We're going to hang out here for 20 seconds now. Just relax, I got you. So the next thing I'm gonna have you do is I'm gonna have you rotate your body so your chest is facing me. I'm gonna support your head. Okay? You're good. I have your head. Just relax. You still doing okay?
I'm still pretty dizzy, but
We're gonna hold this for a little bit longer, and then we're gonna rotate again with your chest facing down on the table. Okay, and then let's rotate down. I still have your head. Can you go all the way down? Here, I'll hold this. We're going to hold this for 5 more seconds. Then we're going to rotate again. Same direction. I still have your head. Rotate once back onto your back. And then we'll sit back up. Okay. How'd that feel?
was not great for the first couple of positions there. Definitely felt a little dizzy, a little bit nauseous, and then my headache was kind of bad. But then the headache kind of stayed throughout the entire thing, and then by the time I got back up to this position, I actually felt a lot less dizzy. So
A lot less dizzy once you got back to normal? Okay.
Yeah.
So that's something that we can keep doing. That's called the modified Epley maneuver.
Okay.
And that is kind of to help with that vertigo that you've been feeling, since I saw some symptoms and you had some symptoms when I put you into that Dix-Hall bike position. That's just one of the tests that we used. So moving on from there, I'm going to try to look at some of the other stuff that you came in feeling, some of that more of that dizziness, that headache, that fatigue, that balance stuff that you mentioned earlier. So I'm going to have you stand up actually. I am going to place what is called a gait belt on you first, just because of the injury that you had and kind of what you were talking about. Please let me know also if this is too tight, if you want it to be tighter. Okay. This is just safety for both of us, and it's a good look. I think so. All right, so if you could stand up now. I'm just going to take a look at your posture now. Feeling okay? Any reproduction of symptoms that you stood up?
I mean, my headache's still there, but I'm not feeling crazy dizzy right now.
If you could take a step back, please. Thank you. So the next thing I'm going to have you do, I'm just going to look at those head movements again. So if you could bring your head all the way back, okay, and then forward, and then look at me, and then look away from me. Okay, any problems with that? You bend your head to the side, touch one ear. Okay, and then the other ear. Okay. So next thing,
It was a little painful on the right as well.
A little painful?
Yeah, going in that direction.
So I know it hurt, or you get symptoms when you bend over, but can you just show me how far you can bend over to try to touch your toes and where the symptoms start?
Oh, right here.
Or right there, okay, stand up. And then can you go back? Any problems with going back at all?
Not really, no.
Okay. Next thing I'm going to do is a quick little balance screen. So what we're going to do is you're just going to stand as narrow as your feet together, and then hands on your hips. And then I want you to close your eyes. We're just going to stand here for 20 seconds. You doing okay?
Mm-hmm.
All right, you got 5 more seconds. Still doing all right?
Yep.
Okay, you can open up your eyes. The next thing that we're gonna do is single leg stance. So which is your dominant leg?
My right.
Okay, so we're not gonna stand on your right then. So we're gonna stand on your left. Okay, so same thing, hands on your hips, eyes closed. We're gonna do 20 seconds.
Eyes closed.
Yep.
Okay. Passing this one, Doc.
How are you feeling?
Pretty dizzy.
All right.
Headaches there like usual.
So the next one we're gonna do is tandem stance. So we're gonna do one foot in front of the other. So for this one, yep, I want your left foot in back. The same thing, hands on your hips, eyes closed. We're gonna do 20 seconds. Okay, 5 more seconds, you got it. And you can open your eyes. So now we're going to repeat the same 3 tests, but we're going to use our modified T-foam here. So you're going to be standing on this now instead of the firm surface that you were on before. Okay? So if you can just stand on that right there, our modified T-foam. The first thing I'm going to have you do, so hands on hips again, narrow stance, and just close your eyes, and we're going to do 20 seconds. How's that feeling versus the firm surface?
It's a little bit harder for sure. Don't really know how I'm gonna do with the other 2. Oh,
You okay?
feeling quite dizzy.
Okay.
To be honest with
That's
you.
20 seconds, you can stop. Next one that we're going to do is kind of hard. You might have to do a little diagonal. We're going to do tandem next, since that one was a little bit easier for you on the firm surface. So same thing, hands on hips, left foot and back. Yep, you got it. Okay, 20 seconds. Doing all right?
Still pretty hard. Kind of dizzy, but
Okay, 5 more seconds. Okay, you can open up your eyes. Last one. So I know you had problems with this the first time. So we're just going to do single leg, perfect. Hands on hips, eyes closed. I'm here though. There's also a table out to your left if you need to reach down. Okay, we can stop there.
Okay.
Okay. You can sit down now, and I'll just kind of go over what that is. So that's just a really quick balance training, seeing different surfaces and stuff. And errors are counted with if you remove your hands from your hips, if you step away, if your eyes open. So with those, you didn't have any errors with that narrow stance, kind of feet together, or tandem. But where you struggled was kind of that single leg stance, both on that firm surface and on that modified T-foam. So I think that is something that we could do moving on in the future that will help with, you know, your overall kind of recovery, especially with a lot of balance stuff. And, you know, soccer's a lot of quick turns, so getting into that kind of stuff will be helpful, I think, and a little bit activity specific for you. Next thing I'm gonna have us do is called a dual task tug. So if you could come join me on the chair over here. If you could just sit down. So about 10 feet away, we've got this nice obstacle here. And what I'm gonna have you do is you're gonna stand up, walk down around the article, and sit back down, okay? And so, but while you're doing that, we're gonna have you name the team members on your team, okay? Okay. So they're just their first names. Last names are gonna be difficult, but so just first names, okay? Okay. We're gonna do one practice. We're gonna do it. You don't have to say the names for that one, but for the actual one, I want you to say the names, okay?
So do a practice run first?
Yep.
Okay.
We're gonna do that. Practice one, run first. Alright, so we're gonna do practice run first, whenever you're ready.
Alright, you want me to name anything this time?
No. Alrighty, so you've got about 8 seconds there, okay? So this is gonna be a real one, okay? So whenever you're ready, so just a reminder, stand up, walk around, but I also want you to be saying the names of your teammates at the same time, okay?
Okay.
And ready, whenever you're, okay.
Timmy, Rodrigo, Alex, Domingo,
Okay. So that one was about 12 seconds.
Okay.
We got about 5 names in. So what we're gonna do, we're gonna do it one more time. Okay? That way we can get an average. Okay? So once again, you can take a break whenever you're ready though. Okay.
Ryan, Richard, Ronnie, Thomas,
Alright, well, we got about 6 names this time.
yeah.
Took you about 14 seconds, so.
Okay.
Alright, so what we can see here, we'll just go back and I can have you sitting at the edge of the table again. Okay. We're going to continue with our treatment. So if you could just sit at the edge. So for that, we got 12 seconds on his first actual trial and 14 seconds on his second one with the dual task, naming teammates' names. We're going to move into some quick testing, just really quick. Yep, that belt is on for a reason. So what I'm going to have you do is just shrug your shoulders and then match my resistance. Okay. And if you go here, push up, push down, and do a motorcycle. And spread your fingers, squeeze my fingers, don't pull out. Okay. And push down. Push down. All good there. And if you could lift this leg off the table, other leg, kick out. Pull in, kick out, pull in, point your toes up, pull in, push down, pull in, push down, just your big toe to the ceiling. Okay, next thing I'm gonna do is I'm gonna touch 2 different areas on your body. You're gonna tell me if it feels the same or different on either side, and for that I need your eyes closed. This here. If you could open up your eyes though, this is what it's going to feel like. So it's going to be like this. You're going to say, oh, those feel the same. Hopefully. Okay, so if you could close your eyes.
Same. 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 Oh, sorry. Same. 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 Same.
Okay, good. Now you can open your eyes. I'm gonna test your reflexes now. So if you could just put your arm right here. Next thing I'm gonna do, if you can pull your hands apart like this. Really pull. Okay. You feeling alright still? No reproduction of symptoms?
No, nothing right now other than the headache. But I mean, that's there anyways. So.
So if I could have you scoot over to the edge of the table, I'm going to try to do something that's going to help with your headache. This is called a snag, and this is something that I could give you, if it works, that you could use at home as well. Okay? So in order to do this, I'm going to have to hold your head. How does that feel, besides the pressure I'm putting on your forehead?
Pretty good.
Okay. I'm just going to hang out here though for a second. Keep doing it. If it's helping. Okay. How's that feel?
Yeah, I like that.
Besides
Sounds
the
good.
awkward arm in your face.
It's good.
Okay. I'm going to try another one now too though. How do you feel about this one?
This one, not so much.
Not so much, that first one though? Okay. That's something I can incorporate for the future to try to help with your headache. Would you say that headache's gone down a little bit at all?
Yeah, I probably went from an 8 to down to like a 6.
Okay.
Maybe a little bit better than that.
So we'll keep repeating that throughout the session just to see if we can get it down a little bit lower from that 6. Next thing I am going to have you do is lay on your back, please. Either way, yeah. I'm just going to be palpating your neck a little bit, seeing if anything's tender. Once again, at any point, if I'm reproducing any of your symptoms, anything that's familiar to you, you let me know.
Okay. And right underneath where you're right there is kind of tender.
Kind of tender.
Yeah.
Is it painful tender, or does it kind of feel like, oh, this is where some of the pain's been, and it's kind of just releasing now?
It feels good when you press on it. It's tender, but it's that makes it better if anything. It's kind of weird to try to describe, but
Then are there some pain coming up here at all? I'm just,
it's more
not from a feeling, I'm just trying to get like an image of your pain now.
yeah,
So it's just kind of, okay.
just underneath there.
Okay. Right here, I'm just testing some segmental mobility, see everything's moving alright still. Any pain or problems with this? Just probably tender with my hand placement.
Yeah, it's not anything crazy. Headache's still kind of there. Might, you know.
Okay. So I'm just gonna hang out here for a little bit, massage this a little bit more. And the last thing we're gonna have you do before we go into what I want to do with you for the day is if you could roll over onto your stomach. I know I don't have a head roll on this table, so it'll be quick. So right here, I'm just gonna pop it a little bit more. So it's this area. Just check your spine really quick. Those upper cervical rotatories seem a little inflamed. Now you can sit up and we can talk about what I want to do, what we can do. So I think a big thing that we're seeing with you, obviously, is that headache. So if we continue to do that snag, what I did earlier, we'll keep doing that in the clinic today, but I'm also going to give you a self-snag that you can do at home. So I'll teach you that right now. You can use a towel for this, a pillowcase. So I'll show you it first, and then I'll kind of instruct it with you. So you know that part, that bony part that you said that I was feeling earlier, that felt good. So I'm just going to have you place it behind there. You're going to go one side up, one side across, and you're just going to kind of pull across with that one that's going up. Does that kind of make sense? Here. So, yep, right on that bony part, one side down, one side up, and you're going to pull across your faces in that. And that's kind of give you that a similar motion to that, what I was doing with my hands on your head earlier in that awkward position. So really, I'm not giving you a number that you can do on these at home. If you're feeling your headache flare up, go ahead and do those. Hopefully this will calm it down a little bit. It's not something that you can overdo, you know, it's going to help with that where you're coming in for.
Sure, yeah, I like that.
Okay, so the next thing I'm going to have you do is, just because that neck has been overworking lately, we're going to do some cervical isometrics. So same thing here, I'm just going to show you first and then we'll do them. So you're going to place your hand on the right side of your head and then kind of give a light push and just hold it there. You know, hold for 5 seconds, relax, and then do it again. Hold for 5 seconds, relax. Same thing on the other side. Hold for 5 seconds, relax. Same thing, hand on going forward. You can look down a little bit, make it a little bit more comfortable. These are all holding for 5 seconds and relaxing. We're gonna do 5 of them, so that's easy to remember, right? 5 by 5. Okay, then you could do backwards as well. You could do both hands. You could do one hand if you like. Hold for 5 seconds and relax. Okay, how'd those feel?
Good.
Okay, that's going to help a lot with a lot of the balance stuff also, as well as maintaining a good posture of your neck, especially with the slight forward head that I noticed while doing your posture, and kind of those inflamed rotatories in that upper cervical that I saw. I know you don't understand most of these words, but over the course of time, I'll teach you, okay? Next thing I'm going to have you do is stand up. We're just going to try to work on that balance, okay? You can turn and face the table if you'd like, just because I know this was a little bit hard. And we're really just going to tease out that single leg balance that we saw. So with this though, we're going to keep your eyes open for now. And you can work, we're going to work both legs. So you can start with that left. That table is here to support you. You can do this at home with a kitchen counter. Just please, if you are doing this, make sure you have one of your parents there to help you, just because of the symptoms that you have been having. So what I want you to try to do is 4 times on each leg, 30 seconds hold. And if that gets too easy, I want you to progress to having your eyes closed, okay, for each of those. Or you could split it up, do 2 with your eyes open, 2 with your eyes closed. And I want you to do that twice a day.
Okay.
And that's all we're gonna do today. But next time you come in, we're gonna do that maneuver that I did where you're rotating a lot. I'm gonna be holding your head and rotating, since I think that seemed to help your symptoms quite a bit. So with that, I want you to be doing that self-snag at home with a towel.
Okay.
Those isometrics. And then also that balance activity that we just did.
Okay.
So I'll give you a printout of that, and I'll also send a printout to your parents' email, so that they know that that's what I want you to do, with a lot of instructions, what I want from them as far as safety while balancing. Do you have any questions for me going forward?
Nope.
Okay. I really liked what I saw with you coming in today and the symptoms and how they kind of progressed. I think that you coming in here, it'll be very helpful, and I think that we can help you out a lot here.
Okay.
All right, thank you.
Let's do it.